Hello, I'm Dr. Siu Ng. I'm a gastroenterologist at the Department of Medicine, Chinese University of Hong Kong. On behalf of my co-authors, I'd like to thank the editors of Gastroenterology for inviting us to discuss a paper of ours that's due to be published in the July issue of Gastroenterology this year. So this paper is called Incidence and Phenotype of Inflammatory Bowel Disease, based on results of the Asia-Pacific Crohn's and Colitis epidemiologic study. This is in fact a collaborative study between 9 countries in Asia-Pacific. So in the past few decades, the epidemiology of inflammatory bowel disease has changed in many ways. So incidence in traditionally high incidence areas such as America and Europe has remained relatively stable, whilst the disease has become more prevalent in previously low incidence areas, including Asia. And although more than 4 billion people live in the Asia-Pacific region, there are currently really a lack of population-based epidemiologic data. And until recently, in fact, inflammatory bowel disease was not considered a public health problem here. So what we did was to perform a prospective population-based study to define the incidence and phenotype of inflammatory bowel disease over a 1-year period across 9 countries in Asia-Pacific. And these countries involve Australia, Hong Kong, Indonesia, mainland China, Macau, Malaysia, Sri Lanka, Singapore, as well as Thailand. So to do this, we first have to select geographically well-defined regions with relatively stable populations. And to ascertain the new cases, multiple overlapping sources were performed, and then cases were entered into the web-based database. Because the infections risks are quite prevalent in Asia, tuberculosis has to be rigorously excluded. And lastly, we also search all local endoscopy, pathology, as well as pharmacy records for keywords in order to complete all the case capture. So what we found was that over a course of 1 year, 419 new cases of inflammatory bowel disease was reported, and about 55% were ulcerative colitis, 40% were Crohn's disease, and there was 5% of indeterminate colitis. When we calculated the crude annual incidence, in Australia, the crude annual incidence per 100,000 people was 23.67, whilst in the rest of Asia, it varied from 0.54 up to 3.44 per 100,000 people. The ratio of ulcerative colitis to Crohn's disease was also interesting. It was 0.5 in Australia, and it was more than 2 in Asia. We then compared the phenotype of the disease between Australia and Asia, and found that for disease location for both Crohn's and ulcerative colitis, they were similar between Australia and Asia. However, in Asia, there were actually more penetrating disease, but there was less family history of inflammatory bowel disease. So overall, we felt that these results have several implications. First, we've shown that the incidence of inflammatory bowel disease in Australia is equal to one of the highest in the world. And this is likely because Australia shared many possible environmental factors that's similar and similar genetic background to the rest of Europe as well as America. And secondly, although the incidence of inflammatory bowel disease is still lower in Asia than the West, this really represents a clinically sort of important finding, given that more than 20 years ago, inflammatory bowel disease was rare or even non-existent in Asia. And we expect that the incidence will continue to sort of rise over time. And thirdly, within Asia itself, there was geographic variability of incidence that would support the hypothesis that environmental factors likely influence different populations at different rates and even at different time points. And I think lastly, contrary to what our belief was, penetrating disease, uncomplicated disease for Crohn's disease is in fact more or even as common in Asia than the West, and this would have healthcare implications as well as management. Overall, we felt that the emerging incidence of inflammatory bowel disease in Asia really provides a unique opportunity for us to study the etiology of these disorders. Thank you.